Hello, it's me, Dr. Catherine Toomer, and thank you for joining us for Dr. Toomer Talks. And I'm here today with Dr. Melinda Ring. And I almost said Rich, and I'm like, I always do that. It's like I know your name, and then I
Well, you got
pause
my
right at the
first name
beginning.
right. Most people call me Melissa or Michelle or whatever.
And for those of you who are joining for the first time, I'm Dr. Catherine Toomer. I'm a family medicine and community health physician and founder of Health, Wellness, and Weight Loss Centers, where I help people maximize their health and wellness through weight loss using a biopsychosocial system, either individually or in a group. And I'm here today with Dr. Melinda Ring, who is just really quite prominent in the integrative medicine, as well as using food for health. Because, as many of you know, I get a lot of questions about how to eat healthier. We're always told to eat healthier, and we're never told how. And so this is going to be a time. So if you have questions, make sure you get them in. We're going to be talking about supplements. We're talking about, she also wrote a book on food and menopause. I mean, I know I get a lot of questions about that. So this is your chance to ask questions and get them in. And I'm going to say hi to Chris. Thank you for coming. And for anyone else who comes in, just say hello. And if you watch later, just put in #replay. So Dr. Ring, please introduce yourself to our audience.
Thanks so much, Catherine. So I'm Melinda Ring, yes. And I am currently director of the Osher Center for Integrative Health at Northwestern University. I've been in the field of integrative medicine, which for those of you who don't know, there's a lot of ways you can describe it, but it's really, integrative medicine is really about taking the whole person view, this biopsychosocial spiritual view, and looking at the individual person, and then also looking at what other things are in our toolbox, what other healing traditions can we have, whether it's acupuncture, what kind of nutritional strategies, what herbal supplements instead of medications. So it's really a whole person view. So I work at that center and teach a fellowship and teach culinary medicine and do all kinds of fun things, all in this area of trying to help people like you, Catherine, like help people get to their optimal self.
Yes. And so now we hear a lot about integrative medicine and we hear a lot about functional medicine. Yeah. How do they differ?
They used to differ a lot more than they do now. You know, if you look at, again, that definition of integrative medicine, it was really about the whole person approach and the provider being a partner in the healing process and helping empower the patient through their innate healing capacity and all of that. So it's a very holistic view. Functional medicine is sometimes called root cause medicine. And so it looks more at like, well, what are some of those, and it really digs into what are some of those underlying factors that cause disease, like inflammation causes not just things that end in itis, but it also causes heart disease and lung disease and cancer, all from inflammation. The immune system, hormone imbalances, nutrient deficiencies, detoxification issues. So functional medicine sort of describes itself as looking at that person, but then figuring out what is wrong at the root instead of just treating all of the things once they're kind of up at these different branches. And those used to be very distinct fields. Lifestyle medicine too is another related field, but now I feel like they're all kind of blending together in this soup. So I'm primarily, I trained as integrative medicine, but I'm also certified in functional medicine and in lifestyle medicine, and they all just blend together. So just like there's an individual patient, if somebody who's listening and they're like, should I go see an integrative provider or a functional medicine or a lifestyle medicine? I have to say that you should look at the individual person and see how they practice, because you can't go by that term anymore.
Exactly. In fact, I often tell people when I'm trained many, many years ago, I won't say how many, it was all family medicine. So we had an acupuncturist in our training, my
Oh,
training program,
wow.
a masseuse. We had our PharmD was also an herbalist. And so it was all part of it. And it wasn't until later that I started hearing about. So it's really wonderful to see it becoming more and more concentrated, because when I trained, everyone sort of looked at us like we had two heads. And now,
Mm,
now it's really wonderful to see. And so when someone does look for you mentioned, finding the individual and paying attention to how the
yeah.
individual practices, what exactly should someone be looking for?
I think it depends what somebody's needs are.
Hmm.
There are, for one thing, you want somebody who is well qualified. Like, you got to start there. And if you go to the Institute for Functional Medicine or the Academic Consortium of Integrative Health and Medicine, some of these larger organizations, a lot of times they'll have listings of people who have completed certification. There's now a board of integrative medicine. So looking for a physician who's board certified in integrative medicine is a good sign that they've had good training, have the knowledge to pass that exam. So that's the first level, is making sure you're going to get good care. And then it's really, what are you interested in? Some people come in and they want to do a lot of tests, like these functional medicine tests. Can you do a stool test? Can we look at your cortisol panel? Do I have food allergies? And what do you think about that test? That's much more in line with a functional medicine versus somebody who is going to do it based more on your symptoms and some of your labs and just really what you're presenting with, and then looking at what other things can we do for that particular issue. So it kind of comes down to what you're looking for, and everybody has different needs.
All right. Well, you mentioned something you can do. Now, you teach a course on culinary medicine.
Yep.
Is that correct? So, what is that? What does it mean? And how can we use it to improve our health?
So, yes, at Northwestern, we created a course called Cooking Up Health. I get a lot of questions from patients and community people about how can I take it? And sadly, it is for medical trainees at this point. It's for people who are training to be health professionals, and we're trying to get more docs to know about nutrition so they can help their patients. So it's not this is not a patient direct culinary medicine experience. To learn a little bit more just about it, I would say I have a TED Talk that people are welcome to go watch for like a 12-minute thing to learn about what we're doing and get a few of those pearls. I like the definition that Dr. John LaPuma wrote in his article, which is that culinary medicine is about taking the art of cooking and combining it with the science of nutrition and medicine. And so that's really what we're doing, is saying, and Catherine, I'm sure you're all about this, but, too often patients go to their doctor and they're told like, oh, you should eat a low sodium diet. Oh, you should watch your sugar or watch your carbs. And they don't know how to translate that, or even like, you should eat X milligrams of sodium a day. What does that mean? And so culinary medicine is about making it practical, hands-on, not just you should eat more vegetables, but here's how you actually can prepare and cook your vegetables so that they're delicious and you're going to enjoy eating them. And all, again, following evidence to make the change and prevent and treat disease.
Well, several of the people who listen are physicians. Now, is this a course that any physician can take, or do you have to be at Northwestern in order to take it?
We've trained, it is primarily for we run it at Northwestern for the medical students and for the residents. We've trained faculty in other places, so it's being offered in different places. I would say if it's a physician who is in practice, not a trainee, that there are some other courses or conferences that I'd recommend, like the wonderful Healthy Kitchens, Healthy Lives conference that's every year in Napa. at the Culinary Institute of America. That's a great place to go, and other ones like that. So yeah, there are some really tasty ways to get your education if you're a doc.
Oh, thank you. And I just want to say hi to Dr. Una for joining us. Thank you for joining. And and also if anyone's listening and they have questions, we can see them. So if you'd like to ask a few questions, that would be great. So now you also wrote a book on food and menopause. Um, I get a lot of questions again about how you can eat in a way to help reduce the symptoms of menopause. Could you talk a little bit about that?
Sure. So this book was a long time ago.
Oh, okay.
Natural approaches to menopause. It hasn't changed that much. Really, I think my biggest cohort of patients that I see are women in perimenopause and beyond who are really concerned about hormonal issues. One of the biggest complaints is, of course, weight gain, starting to have belly fat after menopause or around menopause. And so, I will say, side note, like I am a big fan of using hormones for menopause. I think that's now been borne out by the latest North American Menopause Society study or statement in 2022. So you can treat a lot of the symptoms like hot flashes with things like soy and other kinds of things. But they're not going to reach the level of taking estrogen. There's no question about it. Okay. And so I think, I tend to advocate for a pretty plant-based diet, plant-forward type diet. I do find that I would say women in the perimenopause and beyond range start to deal with more issues with insulin resistance, and they oftentimes do better with a little bit of a lower carb. I'm not sure what your philosophy is, not necessarily keto, but I find that they oftentimes will do with a lower carb percentage, maybe some gentle intermittent fasting blended in, and really, again, managing stress, since we know cortisol has such an impact on holding on to adipose tissue, breaking down muscle. And so, again, that's kind of my approach in menopause, is to go, more plant-based, but not too heavy on the carbs.
Okay. And I'm glad to hear you say that, because I harp on that a lot.
Okay.
And it's nice to have someone else say it as well. So you see, everyone, it's not just me.
Fist bump. Oh no, it's the other way. Fist bump over there.
So now you had mentioned that you've given a talk on supplements. And I get a lot of questions about supplements. And so how do we know when it's time to take them, or should we just automatically take them? Because from what I've read, that our food does not have the same level of nutrients that it used to, because soil has been stripped essentially. Yeah. And so what should we be taking? How can we use it? How do we just find out, who do we talk to then to get an idea if it's not your typical stuff, like you're just multivitamin, if you need something more than just that?
Well, even I would say the multivitamin, the vitamin D, all of the fish oil, sort of the basics. I see too many people who are just getting not good brands, and quality definitely makes a difference when it comes to supplements. It is incorrect to say that they are not FDA regulated. So supplements are FDA regulated. It's just that they're regulated in a different way than pharmaceuticals. So the major difference when it comes between food, dietary supplements, and then drugs, dietary supplements fall a little, in between food and pharmaceuticals. And so they do not require pre-market testing and approval by the FDA before they can be put on the shelves. Once they're on the shelves, at this point, the FDA does regulate them. They can pull them for safety issues. The FTC, reviews them for marketing claims, like, so you'll lose 10 pounds in 2 days. Like, I don't think you should be saying that kind of thing. And so they're, at a basic level, quality and safety is number one. There are certainly cases of adulteration, primarily, again, with your cohort of people. The three biggest categories of supplements that are adulterated, is weight loss supplements. They'll have drugs in them, bodybuilding, and sexual enhancement. So at least one of those categories I know relates to your patients. And so it is just really important to not fall for that quick promise and to get good quality supplements. Berberine is a great example of that, with it being nature's Ozempic, lots of TikTok videos. I love berberine. It's one of my favorite supplements, and it can help with potentially with insulin resistance, potentially with fat distribution, but it's not nature's Ozempic. Like, there's no way. So anyway, safety number one. And you can look for, one of the best tools that I tell both patients and docs is go to something like consumerlab.com, which is a pretty reasonable subscription cost. I don't know, it's like $30 a year. And they do independent testing, so you can at least see if you're getting a good quality supplement. It doesn't say it works, but it says it's a good quality supplement, and you got to start there. And then again, for docs, evidence, does it work? That's where something like Natural Medicine's database and really doing literature searches into that can be helpful.
Okay, thank you. I just want to say hello to Tawana. She did ask the questions, what are some of the brands that you would recommend? She did put the link that you mentioned, consumerlab.com. So are there any particular brands, or is it just simply that depending on what it is that you need, you should go and do your research?
There is a lot of brands that I like, and I have a light from the window that's kind of shining in me. I'm trying to avoid it. Maybe I should just accept it that I'm there's a lot of brands. I am not affiliated with any of them. There's different brands I like for different things. Like if you talk about a readily available fish oil, Nordic Naturals, Carlson's, readily available good brands, things like Jarrow. I like for bone supplements. There's some pharmaceutical grade type supplements like Thorne and Integrative Therapeutics, Pure Encapsulations. I like all of those, and others. And another good, like readily available one is Gaia. So there's, Nature Made. If you get the green top one, those are good quality supplements. So there's a lot of good ones, but I kind of have my favorites for different things. Like, oh, you need this for osteoporosis, or you have osteopenia. We want to use this type of calcium. Oh, you have insulin resistance. Okay, here's the one I like for you. And so that's my personal preference.
So I do have a question, because I'll have someone go through. We're going to pull all this information out and list it for everyone. But if I just wanted to go, say, to my local CVS, and it's like, you know what, I'm just going to get something. You mentioned Nature's Made with the green top. Where should I start? Is there someplace I should start, or should I actually talk to my physician first, figure out what it is that I need to correct first, and then start searching, or can I start now?
I think it depends on what someone's resources are. I wouldn't start adding a lot of herbal supplements or high dose supplements without working with a physician. I personally prefer to test. I like to know if somebody's deficient in certain things before just recommending a blanket bundle of things. And so I'm sort of known in my patients for like somewhat of a vampire, at least, especially at the first visit. Like, I really want to dig. I do like to do root cause medicine. I like to know what we're treating and then treat to that. And it, goes the other way too. I have people who come in and they're taking 20 supplements. I'm like, why are you taking all of these? Like, let's take off the ones that you don't need, because sometimes people end up taking 20, but they're like, oh, I'll take one this day, and then I'll take this once a week. And then none of them end up being therapeutic. So, it's important to know what you should be taking. And that's really where working with an integrative or functional medicine trained physician can be helpful. But like some basics, if you had to go basics, I think most people need a multivitamin. Most people need vitamin D. If you have inflammation, my favorites are things like curcumin and ginger and fish oil when appropriate. And, gut, you've got the gut is so important to everything. Hippocrates said all disease starts in the gut. And so if there's any gut dysfunction, if you're not pooping every day, if you've got bloating or you don't feel good after you eat, you got to start in the gut and heal the gut. And you can test for that, or you can just try to balance it out with diet and supplements.
Okay. And when you say supplements, are you talking probiotics or something else?
So it depends on what the issue is, right? And there is a lot of dysbiosis in this country world where we have trillions of bacteria in our gut, but there can be an imbalance in them. We want to have a lot of diversity in the bacteria in our gut and not overgrowth of one. Too much of a good thing is not a good thing. Yeah. And so it's really about the balance. And of course, there's a lot more awareness now about small intestinal bacterial overgrowth. So if you have too many bacteria in the small intestine and are getting bloated, throughout the day, especially after you eat, you do not want to add probiotics into that mix. We want to suppress the excess bacteria before we start healing the gut. So it really depends what's going on and where the issue is. So again, no quick answer for you. There are appropriate fixes wherever the issue is, but first you have to know where the problem is. Don't just throw on a probiotic if you're bloating, because you may be
making it worse.
You may make it much worse.
Okay. So if someone wanted to find a integrative medicine physician, is there a database somewhere they can look so they can find someone in their area?
Yeah, so that the Academic Consortium of Integrative Medicine and Health is the national organization. It's over 70 health systems and hospitals and lists, so there you can find where is your local academic center. Like I'm at Northwestern. So you could find that there. Like I said, the Institute for Functional Medicine for functionally medicine-based trained physicians. And University of Arizona has the largest fellowship in integrative medicine. So if you go to the University of Arizona, the Dr. Andrew Weil Center now for Integrative Medicine, they list all of the graduates of their program. Okay. I don't think the American Board of Integrative Medicine yet has a database of board certified physicians, but I've asked for it. So hopefully that'll be coming soon.
All right. Well, if someone wanted to find you, they could follow your information and because there is a lot and it's really good. And if someone wanted to follow you, what's the best way they could find you?
The best way to find all sorts of stuff is just go to my link in bio at drmelindaring.com. Oh, you got it. You're so fast. You're so fast. I have some free downloads there. I have like a culinary medicine cookbook for anti-inflammatory recipes that talks about it. I have a free download on plant-based protein, including some of the recipes and some tips. And then something that's very in line with Catherine, your work, which is like sort of the wellness model and trying to figure out, where are you in balance and mapping that out. And so some free downloads, you can find my Instagram, YouTube, all of that there, as well as my clinical work at Northwestern.
Great. Well, thank you so much. I mean, I will be going through this and writing stuff down more and more. And
if you need me to clarify anything or send you links to anything, just let me know, because I'm all about making sure things are accurate.
Yes. And it was very, very helpful, very, very informative. And, you can go to her website and look and pull up that information. I know I will be doing that. If any of you are working with me, you will be seeing them in our group. And so, but thank you so much.
Oh, yeah, it was so fun.
This has been such a great wealth of information.
Yeah, well, I love getting a chance to talk to like-minded gals. So, it's been a pleasure, and I love following your work too.
Oh, well, thank you. Good night, everyone, and thank you for joining in. And we'll see you again next Tuesday for Dr. Toomer Talks. On Tuesday,
Bye.
another alliteration I love.